Now we have two parallel panel discussions. In audio one, there will be a public sector discussion on digital technologies in healthcare, shaping future landscape of India's healthcare system. This will be moderated by Milan Narendra, partner in consulting Ernst & Young LLP. In audio 2, there will be an enterprise panel discussion on how real are the next-gen realities, IoT, telemedicine, robots, and drones. This will be moderated by Shipra Malhotra, Executive Editor, Special Initiatives, etcio.com and etcso.com. Over to you, Mr. Narendra and Shipra.
Hello, everyone. It's really great to be here for this panel discussion on digital technologies in healthcare, shaping future landscape of India's healthcare. Topic quite apt and relevant in today's time of COVID. I'm Milan Narendra. I'm a partner with Ernst & Young, focusing on digital health in the government and public sector domain. I'm also joined by distinguished panelists over here. We have Dr. KV Thrilok, who's the Commissioner, Health and Family Welfare Department with the Karnataka government. We have Dr. Heera. He's the Additional Mission Director, National Health Mission, Government of Uttar Pradesh. We also are joined with Mr. Abhishek Kumar, who's the Executive Director, IT at the National Health Authority. And we have Dr. Ruma Bhargava, who's the lead healthcare practice, who leads the healthcare practice at the World Economic Forum. We look forward to a great discussion by the panelists, and would also like to thank them for coming on board and volunteering to share their perspective on the topic of digital technologies in healthcare. With that, I'll just request Dr. Heera to share UP's experience during the wave 2, the second wave, and how probably they went about, given the largest state, huge amount of investments, or I would say the budgetary provisions they already have, which they take care of. But having said that, they have been using technology and otherwise also, whether it was the entire oxygen supply chain and various other aspects. All of us have been reading about UP at the front line of handling the second wave. So I'll just request Dr. Heera to share his views around that.
During the second wave, we used unified digital platform, and we developed that platform within a short period of 3 months. And with this platform, we did all the activities paperless. And it was user friendly, and all the field officials use it without any problems. And 3T, track, test, and treat, was done in all the country in a paperless mode. And we did not give any formal training. And this was a good experience for all of us. And with this initiative, with this technological initiative, now the technological adoption in the field of healthcare has gone down. Now people are ready, and people are accepting technology in healthcare, and it helped a lot in managing the COVID phase 2, to minimize the pandemic, to minimize the losses, to minimize the pains. So it is a good experience. And already we do have a TSU, technical support unit, and we do have the many experts in terms of professional experts who are advising us in all the aspects of using technology. So that is, I would like to share over here in your discussion.
Sure, sir. Thanks a lot. I think that's really impressive. If you look at the way you went ahead and the state went ahead, I also understand directly the CM had been at the front line and working back with the entire machinery and seeing how technology could be leveraged at each of those stages. With that, I'll come to Mr. Abhishek Kumar, He is the executive director at National Health Authority and a known face for all of us, and been the architect, or I would say the person who's been driving the entire adoption of National Digital Health Mission. So, Mr. Abhishek Kumar, would you like to update the audience over here about how the entire National Digital Health Mission is being driven, the status around it, and what's being planned? We do keep hearing in the media and the launches which you are doing of various, I would say, consultation discussions on various components. So if you could share some of those and other aspects as well.
As we know, National Digital Health Mission, as on date, is a very critical initiative in healthcare sector, and it has become especially very significant in the post-COVID scenario. Reason is that after COVID, everybody tends to avoid physical connect and people prefer digital interactions. So, in healthcare sector as well, it is very important that people are able to get teleconsultations, and there is no need to visit hospitals or labs as far as possible. So basically, National Digital Health Mission seeks to create an interoperable digital health ecosystem. If we see digital sector, it is no different from, I will say, more tangible sector where goods and services are very much visible, like roads or infrastructure. There, government creates some public goods and various activities, industrial activities and other related activities flourish on the backbone of those public goods. Even in the digital sector, it is quite similar, that government has to create some public digital goods, and that enables various value-added services, and that unleashes the potential for various innovations in that sector. So it is very similar thing even in digital domain. So National Digital Health Mission seeks to create various public digital goods in the form of various registries, various standards, which will unleash the potential of this sector, and on the top of that, various value-added services can be created by public sector players or private sector players. So that is the basic idea of NDHM. As we know, pilot project of NDHM was launched by Honorable Prime Minister last year on 15th August, and from that time, the project is going on in pilot mode in 6 union territories. And going ahead, there will be expansion of the project, and accordingly geographical territory as well as scope of services are bound to be expanded. In the meantime, there are evolution in terms of various ideas related to NDHM. As we know, NDHM is quite exploratory and evolving kind of project. So because of that, many ideas keep on changing. Recently, NDHM has published 3 important consultation papers. They are on Healthcare Professional Registry, Health Facility Registry, and UHI, that is Unified Health Interface. So to explain the concept of these consultation papers, let me briefly discuss about the core construct of NDHM. In very simple term, NDHM consists of only 2 things: registries and standards specifications. So let me talk about first component, registry. So if we talk correspondence to a conversation between 2 people, for an effective conversation between 2 people, 2 conditions need to be satisfied. That the 2 persons need to know each other, who are you, and second is they need to talk in a common language, right? So in the same way, NDHM registries are kind of introduction. That means they create identifiers of various stakeholders like individuals, doctors, healthcare professionals, facility, lab in the ecosystem, so that across India, various entities know one another and effective conversation can take place. Second important aspect is standards and specification. Just like human language, digital systems too need to know the medium or language of communication. So it is the same thing through standards and communication specification. NDHM is trying to lay down a uniform communication mechanism, and that will enable communication between different digital systems. So basically, healthcare professional registry and health facility registry, these two consultation papers have been published to take views of all stakeholders about this aspect. And UHI, Unified Health Interface Consultation paper, that basically talks about standards and specifications. So this is all about basic aspects of NDHM and what is going on during recent times, and we can discuss it further. Thank you.
No, that's really great to hear, and very clearly it's a visionary, I would say, mission which is there, and well thought out, and I would say the kind of impact it's going to have. It's going to change the way healthcare delivery happens in the country. And you rightly said the entire building blocks are being put together by NHA today. And in some of the discussions, there was also a comparison with Aadhaar. While Aadhaar was in a particular domain and a specific use case it had, NDHM tries to bring the entire ecosystem together and much larger in its coverage and its impact, which it would have in the delivery. And it will not only impact the healthcare service delivery just from a public perspective, but the private sector as well, as you rightly said, sir. So that also brings a whole lot of set of challenges and issues. And what I understand, you're also trying to bring in the startup ecosystem into it, and various other technology providers for value-added services even. And there are a whole lot of things and concepts being talked about. Would you like to elaborate on that as well? The value-added services, which you did mention, and how you're trying to bring the ecosystem together for this?
Yeah, so to explain it further, as I explained, NDHM seeks to create basic building blocks on the top of which various value-added applications can thrive. So NDHM seeks to put together basic building blocks, that means registries and standards specifications. But ultimately, any project by government is done to bring benefits to the citizens of the country. And what are the benefits to the citizens which are being intended? The benefits to the citizens are in terms of easy availability of healthcare services, be it teleconsultation, health and wellness services, or any other healthcare related services. So we can take a correspondence to UPI, Unified Payments Interface. Currently, what is the case? Any application, any patient-facing application of, let us say, entity A cannot talk to healthcare service provider of, let us say, entity B. So basically, we are living in silos as on tape. Whereas when it comes to making available best possible services for the citizens of the country, ideally there should be a complete interoperable system where I, as a citizen of this country, can avail of best possible services, and I shouldn't be limited by the factor which application I am using. So after complete implementation of NDHM and specifications like UHI, Unified Health Interface, this barrier will be addressed and people will be able to avail of healthcare services without bothering about the applications which they are using. So to explain it further, on one side, we have citizens of the country who need healthcare services. On the other side, we have healthcare service providers. So there needs to be an effective matching of demand and supply. And for that effective matching, it is very important to create a seamless interoperable network. Apart from that, it is also important that a citizen is able to view various possible options for any particular type of healthcare services. So in NTHM, the concept is that our primary focus is on creating basic or core building blocks, which are essential to establish this interoperable framework, like registries and common speaking language in the form of standards and specification. Coming to second part, building various applications like patient-facing teleconsultation application, healthcare service provider application, whatever health and wellness related applications are concerned. As such, we are not supposed to play a very proactive role into that. Rather, people in the ecosystem, be it public sector players or private sector players, they should be able to build upon the basic building blocks and create innovative solutions so that for citizens of the country, best possible options are available in terms of availing health and wellness services. So that is the basic idea. And once NTHM building blocks are completed and they are fully implemented, obviously there will be opportunities for the innovative minds of this country to build upon basic building blocks and provide best possible solutions. That is the way we currently see the innovation coming into healthcare sector.
It's a great journey which has been initiated by Honorable Prime Minister and the National Health Authority, and you driving that. We at Ernst & Young also day in, day out try and look at and work back with various technology firms. And we've seen the kind of innovation which is happening, whether it is on the devices side of it, even bringing the devices onto it, because there is an integration with the devices which are required. And also to that extent of last mile, how probably a doctor's interface interaction with the with the patient. How does he write a prescription and it gets uploaded into the system so that the life of a doctor becomes better, or maybe voice being used in a lot of those interactions. So those kind of innovations, the startups over there, I would say various research organizations, IISc and various other research organizations are investing so much in everyone coming together to build and help create this ecosystem. I think it's really great kind of experience. And I would say this COVID has just pushed it a couple of years ahead, or maybe 5-6 years ahead, or a decade ahead. The kind of adoption of technology is happening. With that, I'll probably move to Dr. Ruma Bhargava, who's the lead at the WEF, the World Economic Forum for the healthcare. She leads that healthcare practice, and would like to probably, ma'am, understand from you the mandate of WEF in India, and especially the healthcare practice around that. Would like to understand more about that, ma'am.
The healthcare platform especially, and the whole Center for the World Economic Forum in India revolves around emerging technologies. And how we started and conceptualized the strategy for healthcare in India was that if we look at the present health status in India, it's like a testament that be it the sustainable development goals of achieving health for all, or be it the objectives laid out in the national health policy of reducing maternal mortality, or digitizing health records, which Abhishek was mentioning, or be it reducing the burden of communicable and non-communicable diseases, we are far ahead from reaching the targets set. So what we thought of as a community in the World Economic Forum, because we follow an institutional culture whereby we call on experts from the government, from the industry, from the academia, from NGOs, and we promulgated a strategy called as First Health, which is Fourth Industrial Revolution for Sustainable Transformation of Healthcare. And therein we deliberated on the disease burden of the country, as well as the out-of-pocket expenditures, which are the prominent diseases which claim most of the lives. And as we have seen that annually, like 63 million of people every year are pushed into poverty. So with the deliberation of these experts, we identified 18 themes, that is the 18 disease areas, divided into preventive, curative, and governance aspects of healthcare. So to give an example, for like how TB is taking a toll, cancer, respiratory diseases, screening, immunization. These were among the 18 themes. To begin with, the strategy in India, we decided that as COVID has struck up and there are the huge burden of non-communicable diseases, which is not being looked at present, it is being ignored, which is there with all the other diseases as well. Because at the behest of COVID, we are ignoring the other diseases, which pose an even greater burden. So we took up cancer as one of the first themes to begin with. And we have been working on how the emerging technologies like artificial intelligence, IoT, blockchain can help bridge the healthcare divide. For example, like how the point of care devices can be used to ensure availability and access to the last mile, how blockchain technologies can be help in insurance to process the claims, how we can use IoTs and clinical decision support not only for the help of the patients, but also to the help of physicians. And once we deliberate, we would be identifying, we have in fact identified some of the technologies. We would soon be framing a strategy as to how to do a pilot with some of the state governments identified and look up and with the learnings of the pilot, how we can scale up that pilot and present the recommendations to the government. So that's very brief of what we do at the World Economic Forum.
That's really impressive, ma'am. And that's a different, I would say, perspective coming together. And I think a lot of people would benefit from this and see how emerging technologies are being leveraged. And you're trying to prove that on the ground by implementing it on the ground. I think that's really commendable. The kind of work which you are doing and the emerging technologies, what kind of challenges do you face on the ground in a country like India? While from an adoption perspective or maybe from a legal perspective, and any suggestions, recommendations, given that we have Mr. Abhishek Kumar as well over here, and so recommendation from the central government perspective, plus what's your guidance for states or other startups? Any of those you would like to share, given your extensive experience of implementing emerging technologies on the ground?
Sure. So before joining the World Economic Forum, I have worked with the Red Cross and was also working with the immunization division in the Ministry of Health. So what I have seen closely is that whenever we talk about last mile delivery, we tend to talk about the 3 A's, Ashas, ANMs, and Anganwadis. And those are our frontline warriors, but yes, they need support, and we cannot be just putting on everything on their shoulders. We need capacity building, and we need to build technologies which are as per their acumen. We need to build on comprehensive technologies, not make technologies in silos for one national health program. It should be a combination of technologies, moreover region specific in their own local language. Also keeping in mind that how user-friendly those technologies are, to provide them refresher trainings on the ground. And more so, I would like to say to invest in primary healthcare, because in India, we have an inverted pyramid structure of healthcare. Our budget focuses mostly, apart from the last 2 budgets where it has been focusing on primary healthcare, but the rest of them, yes, it did focus on secondary and tertiary healthcare. So we need to augment the capacity of our frontline health workers and develop technologies which could target more of the primary healthcare structure in the country, because not only it would help the patient in the long run, having less out-of-pocket expenditures, but also in terms of the disability-adjusted life years of the patient, and also of the governance, that the burden on the secondary and the tertiary level healthcare structures could be reduced.
Sure, ma'am, absolutely. I think that's dot on as you put it across. Ma'am, also from the private sector side, and any guidance to them, the startup ecosystem who keep experimenting on these technologies?
Right. So what I have seen in my experience is that we tend to copy the West in most of our concepts. In India, unfortunately, that doesn't work because we are a very diverse country. In fact, one solution, adopting it in one state might not work in the other. In fact, in a district also, it would not work. So I would say, to the startups, we would have to make up India-specific solutions which could work in the Indian environment. Keeping in mind also the regulations in India, we have a tremendous impetus and boost given by the by the government, be it like the Digital India campaign or the Make in India strategies, and the next one, the NDHM. So the startups need to leverage this, but also keep into mind that what is fit for the Indian ecosystem. They should start, rather than following a top-down approach, it should be a bottom-up approach for the startups that go and study the ground, what is essentially needed, and then formulate the strategies accordingly.
Sure, ma'am. I think that's really pertinent and the golden advice, I would say, for the startup ecosystem. Just coming back to Dr. Heera, so from your point of view, while you did talk about the second wave and how things happened, were you also using technology as emerging technologies during this, whether it was supply chain or whether it was the entire COVID vaccine point of view? Did UP use it? Would you like to share any experiences and how things were handled?
Actually, already state is using DMS for supply chain management, or including a passbook system for all facilities. So already we are using the supply chain related technology, and it gives a clear cut idea to find out, to take timely decision for the indenting the drugs or surgical equipments. And we are aligning the action and activities to build up the national health digital health mission in coming 3-4 years. For that, already we have digital health strategy 19 for with a focus on the next 10 years digital health landscape, and we have allocated funds in the budget of the 2021. So we are trying, and we are in the process to set up all the requirements to digitize the healthcare system of the UP.
Sure, sir. I think that's really great. And as I said, UP has been on the front line of handling it and bringing technology. Personally, EY has been working detailed, I would say, assessment had been done on the entire technology landscape in UP and looking at how probably a roadmap could be created, bringing the public health infrastructure together, the technology together, and as sir, you rightly said, trying to see how probably the supply chain could be relooked at, how emerging technologies come in for other set of service delivery around the healthcare. With that, I'll just move back to Mr. Abhishek Kumar. So any other experience you'd like to share more from a point of view of, say, privacy and other regulations, and also the insurance sector, given the NDHM is coming and the building blocks are coming in place, with PMJAY 2.0 also being there. How do you see that ecosystem moving ahead?
Yeah, so let me explain two aspects. Coming to privacy, whenever any major innovation is done, digital innovation in any sector, and especially in sectors like healthcare sector, concerns are raised related to privacy. So I will quickly explain 4 key aspects related to NDHM project, and that should alleviate all concerns about privacy. First point, NDHM doesn't seek to reinvent the wheel. Whatever existing healthcare ecosystem is there, NDHM just seeks to create a digital layer on the top of existing digital ecosystem of the country. And whatever processes and concepts are there for data sharing, they will remain as it is, right? Just like today, people share their medical records with their doctors, in the same way, it will continue to be shared post-implementation of NDHM. So there is absolutely no question of any concern about that. Second is, NDHM is federated architecture. What it means is that data will continue to remain with respective facilities or hospitals or lab. We are not creating any centralized repository of data. Third is, any data sharing within the framework of NDHM can be done only on the basis of consent, and that is built into the architecture of NDHM. So that way, data principal remains the ultimate custodian of data, and no data can be shared in the NDHM ecosystem without explicit consent of that individual. And one last point, whatever minimal data is being maintained in the centralized systems of NDHM, we are following up international standards for information security. So if we can appreciate these 4 points, there is no reason to be concerned about data privacy and security. And obviously, we understand that in digital world, it is always a challenge and race between the people who are in charge of maintaining these systems and the people who are out there to create security related issues. And we need to be constantly updated, but that is in general true for any digital system. Coming to parties like insurance player or any other party. So as I explained, we are building basic public digital goods, and it can be leveraged by various players in the ecosystem. And general policy of NDHM is based upon open API, open connect kind of system, where subject to compliance to policies and guidelines laid down by NDHM, various applications and various systems can connect to NDHM ecosystem, and they can leverage various services on the top of those registries. So that way NDHM is going to create opportunities for various players in the ecosystem. But obviously the primary objective about which NDHM is focused and committed is that citizens should be able to take benefits of higher quality and easy availability of health and wellness services. That's all.
Very well said, Mr. Abhishek Kumar, from a point of view as to how these concerns have been addressed and the kind of opportunity it throws for the entire ecosystem. But having said that, it also at the same time looks at, okay, how do we cover ourselves as we go along and open this entire thing. In the meantime, ma'am, Dr. Ruma, I'll probably come to you as well on how does the World Economic Forum look at NDHM per se? Any thoughts from your perspective for the central government?
Sure. So, in fact, like in the present project, what we are working on cancer, we are drawing inspiration from NDHM as well. That if we can formulate minimal data sets format for cancer in India, which is compliant with the FHIR standards which NDHM uses. So, because I feel that that is very essential in today's time, as the objectives set out in NDHM are very clear, that data which is, I would say, like data which is a new oil. So that has to be valued, and patient has to be made the center of focus as the custodian of data which NDHM rightly makes. So that's so again, like coming to the same point, that we in our work are drawing inspiration from the principles set out in NDHM, and if we can deploy those principles in one of the areas what we have selected. But the challenge wherein lies would be in adoption of these standards, because NDHM is a voluntary effort, and of course we cannot force anyone to adopt in a democracy where we live. But having the public health facilities would be mandatory, but for the private sector facilities across all scales, encouraging them to come on and board up to this platform, that would be a challenge.
No, absolutely, ma'am. And we also have the privilege of having Dr. KV Thrilok Chandra. He's the Commissioner, Health and Family Welfare Services, Government of Karnataka. And very well, I think he's been at the front of looking at technology and seeing how technology could be used in the state of Karnataka. I would say Karnataka being a front runner. So, I would like your perspective, how Karnataka went about using technology, and also from a point of view, how you see as the next steps of technology for the state.
Government of Karnataka has been pioneering in the use of tele-ICU right from the first wave of COVID. Use of IT tools, including AI. It could be machine learning, deep learning for tele-ICU diagnostics, as well as for home healthcare, we have been trying to deploy all these tools which are available to us. As I said, from the first wave itself, last April, we had partnered with few of the leading private sector players in Bangalore to handhold us with establishing tele-ICU facilities for all the district hospitals in the state. So, which is continuing and which is recognized as a best practice by Government of India as well. Uh, they do tele rounds every day along with all the districts, so that the to overcome the shortage of intensivists which is acutely there in the system. So this model is very scalable and replicable across the country. In fact, many other Niti Aayog also wanted us to handhold some of the northeastern states also, so that the critical shortage of intensivists is taken care of. So the CFR has significantly reduced in these district hospitals, which is on par with some of the best-in-class private hospitals also. So, and we are in the process of augmenting these tele-ICU and telemedicine resources across the state. And we are putting in place tools and systems so that it can be more robust and sustainable. So we look forward to newer tools which are available with the industry, so that we can make the system more stronger and we can take it forward.
Thanks a lot, sir. And I think Karnataka has been in the forefront of leveraging technology and the EICUs which you spoke about. That's something I think other states are looking up to and learning and using that model even as we go for the next set of waves. Having said that, would you also like to share your perspective? Because Karnataka has been also a global destination for healthcare. And a lot of, I would say, people do come in and look up for healthcare service delivery in Karnataka. Given the fact that you're moving out of the COVID and how you use technology, any perspective on that side, how you are making Karnataka future ready, so that whatever has happened, yes, we move ahead and we do look at the global healthcare, I would say, the segments around that and be future ready around it.
Yeah, as I was saying, like we are putting in place systems, like for example, in our health department itself, we are in the process of setting up a central command center. Not just for COVID, we are looking beyond COVID. We are looking at having this facility for, say, pediatric care. It could be oncology, it could be cardiology. So we are tying up with all the institutes of national eminence which are there in Bangalore, so that we can use their services and their expertise which is there, so that when the remote corners of the state can access these services, because not all visits to hospitals have to be made in person. So many of the follow-up consultations, many of the advice which people actually come to hospitals can be made online. So that is the key learning which all the hospitals have learned. So that will actually reduce to a large extent the out-of-pocket expenditure for all the people out there. So I think that would be really a game changer in improving the lifestyle of people, the quality of life, because a lot of time and energy and money is spent on commuting and coming to these centers of excellence. So onboarding these centers of excellence, I think, would be the next step in taking quality care to even the remotest parts of the state and across the country.
Any inputs being from a state perspective at a front line? Any views, any comments on that to the other stakeholders, the panelists who are there?
It would be good to have any new tools which are available with them, which can strengthen our existing system and make it more accessible to people. So I think we would welcome any such latest tools and other IT-related services which they have developed or in the pipeline. Because many of these startups and also centers like IASC have been in touch with us. So many of these startups in this healthcare system, particularly in non-invasive diagnostic measures, particularly as you're aware, NCD has laid bare the mortality data actually. So most of the fatalities are in the NCD segment itself, particularly diabetes and hypertension. And most of these are in a tip of the iceberg phenomenon. Most of them are undiagnosed. People come in late for treatment. By then it's quite late. I think the key feature would be any of these startups or from the World Economic Forum or National Digital Health Mission, they can come up with some good tools for non-invasive diagnosis of hypertension and diabetes. I think that would be a game changer for controlling NCD to a large extent.
Sure, sure. Thanks a lot, sir. And there's a lot of work which is happening. You're aware of the NDHM under NHA with the way they're driving it, or at state level in UP, which is happening, and also the fact that the World Economic Forum is investing a lot on the emerging technologies. And Dr. Ruma Bhargava has spoken about that. We'll just wrap up, and thanks a lot. I'd like to take this opportunity to thank all the panelists, distinguished panelists over here, for taking out time and sharing their perspective on the theme of digital technologies in healthcare. And as we go along during these times, for sure, this would shape the future. There's going to be continued way of working, even without COVID. There will be blended way of working, I would say, of healthcare delivery, as sir also mentioned, where there'll be a physical interaction. But more importantly, I think the first port of call could be the technology, the digital interaction being there. And whether it's across the spectrum, I would say that would happen. What would be required is also that the healthcare providers and the ecosystem designs their health service delivery around that, and that will be important. For the states to look at how probably they would like to leverage the ecosystem, the new things which are getting rolled out by the central ministry, the innovation which is happening, I would say. Not only look at that, learning from each and every other state and trying to see building capacity, very rightly put across by Dr. Ruma Bhargava, building capacity and trying to see how the emerging technologies could be also leveraged. And the entire ecosystem would need to come together around that. And that's being enabled by NHA very clearly, and Karnataka and UP being the front runners, I would say. With that, I'd like to thank all of you and organizations like ET, bringing all these panelists together. I think it's been a great forum. And especially I would like to thank from Ernst & Young point of view as well. And we look forward to being at the front line, working back in this ecosystem and ensuring that the healthcare service delivery improves in the country. With that, thanks a lot for your time. And I like to thank all the panelists and look forward to catching up soon. Thank you.
Thank you, everyone, for delving deep into the discussion. Every point discussed is a learning for our viewers. There's a lot more to take away from this event. Stay connected.